From Fox, bringing you the major headlines from across the nation, bringing you the latest right now when it comes to COVID-19 variants and how they are affecting children. The details are brought to us by our friends at Fox 26 Houston.
For seniors and people with disabilities.
A highly contagious COVID variant appears to be infecting more and more children. So let's bring in Dr. Michael Chang, an infectious disease specialist with UT Health and UT Physicians. Dr. Chang, we know that the UK variant is present here in the Houston area, but are you hearing of more cases in children and teenagers right here locally because of this variant?
Not definitely due to the variants. As far as confirmed cases of the variant in the state of Texas, we've had about 400 cases and about 15,000 across the country. And so the actual sequencing of the virus to identify whether a child has the variant or not takes some time. And so I haven't heard of significantly increased cases due to the variant for sure. That said, we are seeing kind of an increased proportion of cases in kids and in teenagers, although it's still less than the number of cases we're seeing in adults.
Okay, so with children, Dr. Chang, not being vaccinated, what is the risk to parents, whether vaccinated or not?
Yeah, so, we know that this UK variant seems to be about 50% more transmissible, and at least in adults does lead to more severe disease in some cases. And so with kids being not yet vaccinated, there is an increased risk because it is a more contagious variant that kids could have more cases and they could more easily spread it to either vaccinated or unvaccinated parents. Now, the good news is that the vaccines that are available right now, the Pfizer and Moderna vaccines and the Johnson & Johnson vaccine do seem to still be effective against this UK variant. So if you are vaccinated but your child's unvaccinated, you still have some protection even if your child were to get infected with the new variant.
Are the symptoms with the new variant any different, doctor? And can you kind of just sort of outline what parents should be looking for, because it is allergy season as well and things can get a little confusing?
Sure, absolutely. So the symptoms in children, at least, are still similar to all the previous COVID infections. So still, most kids may not have many symptoms at all, and if they do have symptoms, it may just be 1 or 2 days of fever, some runny nose and congestion, maybe some coughing. So like any other cold. So luckily, even though this variant seems more contagious, it's not causing worse symptoms in kids. Now, differentiating from allergies is tough. We usually think about itchy eyes and maybe itchy throat and mouth that comes along with the congestion and coughing. And so certainly if you have itchy eyes or if this is your typical allergy season, you do want to keep that in mind. And you can always try an antihistamine for children to see if that improves the symptoms. Now, the COVID symptoms may also get better within a couple of days for kids, so it could be hard to differentiate. If you have any concerns at all, it can't hurt to get tested. And if you also have concerns about an exposure to COVID or that your child may have it, again, it can't hurt to isolate while you're waiting for test results.
Okay, Dr. Michael Chang with UT Health and UT Physicians, and just a reminder that right now the vaccine is approved in 16 and up, and it could be approved relatively soon in kids as young as 12 as we wait for FDA emergency authorization there as far as the Pfizer vaccine goes. Dr. Chang, thanks for your time as always.
And after a year of COVID-19 precautions, some children have actually developed a fear of germs. Fox 26 Houston is breaking down what you can do if this sounds like your family.
After an entire year of new hygiene habits and trying to be overly cautious to protect ourselves from the coronavirus, some children are really struggling with this and have even gotten anxiety about germs. What can you do about it if this is your child? Well, let's join an expert right now to get some very important tips. Joining us live this morning is Pierre Mata, senior clinician with Family Houston. Good morning, and I'm really glad you're here. Can you explain what could be going on with a child who is overly concerned about what's happening right now?
Sure. There's obviously the pandemic has caused a great deal of anxiety and depression. We're seeing that in research that's showing this increase. And of course, some children are more vulnerable to anxiety and depression, especially if they have experienced some type of trauma. So with the pandemic, and we're seeing that even though there is an increase in vaccinations, and we're starting to return to public, there still is great concern. And so children are going to become anxious, and just like adults, they develop their own ways of coping, and some of those ways of coping are not always healthy.
No, not at all. And we want to try to help address that situation. And I think a lot of times in a situation, it's important to know this, but to know what to do about it. But it's also really important to know what not to do, how to handle this with your kids. So what do you suggest that parents really try to avoid?
So you definitely don't want to overreact to their concerns. They're children and their developmental style, and sometimes their little personalities. They just some, and this about your children. One might not be so afraid, and another might be afraid. So you want to be sensitive, and you don't want to overreact, and you don't want to minimize or shame your child's reaction. So you want to validate your child's concerns, and that's going to be the most helpful to your child.
And it can be really helpful to give your child some coping skills so that they can better deal with their emotions and how they're feeling, maybe their anxiety. So what would some of those be that you would suggest parents to share with their kiddos?
So obviously you want to teach them good hygiene, washing their hands, wearing also safety precautions, wearing their mask, things of that nature. And you do want to give them some basic information. I say basic and limited information. You don't want to overload them, and you definitely want it to be age appropriate. But you want to let them know a little bit about what's going on. That's going to be helpful to them. And then also you want to teach them some things that they can do if they get anxious. So things like deep breathing, things like progressive muscle relaxation, and even some mindfulness, things that you can watch some videos on the internet for children that will be helpful for them at this time.
Is there a certain point when you want parents to realize that maybe this is beyond what they can do to help their child, and they maybe perhaps should seek some professional help?
Yes, so children do grow out of anxieties. I remember I was afraid of cats when I was growing up, and of course I'm not afraid of cats anymore. So children will grow out of phobias, but untreated, the children can develop anxiety disorders, such as obsessive compulsive disorders. And of course, with these kinds of disorders, early intervention is important. So I don't think it ever hurts to take your child to see a therapist and just get evaluated. And the therapist definitely will let you know if it's cause for concern or if it's just normal childhood behavior. Melissa.
All right. Well, I tell you what, it's such important information for parents to realize what's going on in their kids. So thank you for your time today and for sharing this with us.
Thank you.
And Fox 5 Atlanta is bringing us the latest information when it comes to the coronavirus pandemic and vaccine rollouts.
9:33 is your time, and over the last year, many of us have really upped our cleaning game, right? Bleaching and scouring surfaces to try to wipe away the coronavirus. But the CDC says disinfection may not often be necessary, and the risk of picking up the virus from household surfaces is actually pretty low. The Fox Medical team's Beth Galvin joins us live now to talk about the agency's updated cleaning guidelines. Good morning to you, Beth. The CDC saying picking up the virus off surfaces, it's possible but not likely.
Yeah, it is. Portia, I remember early on in the pandemic, I became so hyper aware about how many surfaces are around us that we're touching, and the fact that we're all touching our faces too. And I think we've all learned not to do that. And the CDC is just explaining that what we've realized over the last year is that the main route of transmission of this virus, it's a respiratory virus, is through close contact and through infected particles in the air that are emitted when a sick person or an infected person who may not have symptoms talks or breathes or shouts or coughs. And then if you're within close contact, within about 6 feet of them, it is possible for you to breathe in those infected particles and become infected yourself. And that's the main route of transmission. And what they're learning increasingly and why they're sort of adapting or updating their guidance is that it's usually pretty rare for someone it is possible, to have somebody come into a room, cough on a surface, and then you come in on top of that, touch that surface, touch your face, and infect yourself. But that doesn't happen very often, is what the agency is saying. Portia?
Gotcha. So I'm thinking about we were all rushing around trying to find disinfectant wipes, disinfectant sprays, and now you're saying this. Yeah. So given the most common method of transmission, how often should we be actually cleaning these surfaces, and what really should we be focusing on at this point?
So the agency is saying that regularly, consistently cleaning is really key here, but you don't have to bring out the big guns, the major disinfectants, things like that. It's saying that cleaning with a cleaner that contains soap or detergent regularly is really going to be your best bet on those surfaces. And when we talk about cleaning up surfaces, what they're saying is you're cleaning up, focusing on those high-touch surfaces, and really trying to clean those regularly or clean those, maybe daily. Maybe every other day, cleaning those high-touch surfaces. And when we talk about focusing on the high-touch surfaces, we're talking about things like doorknobs, like tables, handles, light switches, countertops, things like that. And then it says, as far as the other surfaces around your house, Portia, clean them, when they need it or when they become dirty, but you don't have to really be focused on cleaning every single surface in your house constantly. Just focus on those surfaces that have a lot of high contact. A lot of folks in your house are touching and then moving on.
So what we would have been doing during a regular cold and flu season anyway is really where we should just continue, right? Are there times when disinfection is actually recommended?
So the CDC says yes. For almost everything else, soap and water or detergent cleaners are great. Up your game a little bit, use bleach or some other kind of disinfectant if you have somebody in your house who has the virus currently, or else if you're in a situation like it could be a school, it could be a workplace, it could even be your house where somebody within the last 24 hours has been infected with the virus and been in that space. Also really important, not so much surfaces, but keeping those windows open, keeping a good flow of air, because that can kind of lower the risk of somebody coughing on a surface in a very, stuffy place. If they cough on a surface, the germs can live on the surface for a while, but they just don't want people to be super focused on the surfaces and not paying attention to the social distancing and to wearing a mask and those kind of things. Portia?
Understood. All right. Beth Galvin, good information on Good Day, as always, and it's good to see you too.